I'm Dr. Danielle Bello. I'm a board-certified clinical neuropsychologist. I am the Director of Behavioral Health and Education Services here at C4K's. Our behavioral health department really focuses on helping a child and their family cope with the medical illness that they're going through, understand the journey, and see what resources they may need and be able to provide them. This also helps relieve some of the strain during treatment and can lead them to having more resources and more services and be more connected. So there's a lot of different components for our behavioral health department. One of them is our child life specialist. We also have a social worker. We have a learning center with a Clark County School District teacher and a teacher's aide employed by C4K's, and a Clark County School District school counselor. And then we have neuropsychology, which is my role on the team. We are so fortunate to have child life services here in an outpatient clinic. Most child life specialists are housed in inpatient and pediatric hospitals. But here, our child life specialist, Sue Waltermeyer, is really a huge part of the team. She helps a child and their family go through different procedures, helps a child understand in their own words and at their developmental level what this diagnosis means, what treatments are going to look like. She has teaching strategies and teaching models and dolls that really help communicate these points.
So my role is to help make sure that our patients understand their diagnosis and treatment in developmentally appropriate ways, and that I help them find ways to cope with the things that might be difficult about their treatment. So it might be helping them cope with having their port accessed, or it might be helping them understand what leukemia is or what red blood cells do. Whatever it is a child needs in terms of understanding their treatment and their diagnosis, I help them with. I don't use the big medical terms that have lots of letters. I make things very simple and understandable for the kids.
She also provides a sense of distraction. So what else can you be doing while you're here at clinic for a treatment? Are there other things you can be playing or toys you could be working with, and make sure a child's active and involved while here in our clinic? We have a number of different resources and services. So one of them is our social work service, where we provide resources such as assessment of a person's financial needs, how things are going from a social support standpoint, how the family is sort of juggling things through treatment and through this medical journey, as well as what external partners can we use to help supplement some of those resources.
As a social worker here at C4K's, I help to facilitate relationships within the community and also within our own organizations. I connect families to different programs that we have here, whether that's a financial program through our patient financial counselors, or referring them down to the education center, or referring them to Dr. Bello for a neuropsych referral. We try to cover all bases.
So our social work services are vital to helping families go through this journey, cope with the different things that are happening. There's so much going on, and sometimes social work really helps to connect the dots, to coordinate treatment. Some examples could include making sure parents have stable transportation to get the child to appointments, who their family and social support are, so who's watching the other children at home, what else needs to happen from a financial standpoint. Maybe one parent or both parents can't work for whatever reason, and maybe now there's some financial strain. And so how do we make sure that they're still paying their bills and can live where they need to live? In our clinic, we have the Andre Agassi Foundation for Education Learning Center. And this is really a crucial component to help our patients and their siblings to keep up with school and make sure they're getting all the things that they need. Within the Learning Center, we have a Clark County School District teacher who is full-time in our clinic, even though that person is employed by our Clark County School District, so we have a partnership with the school district. They understand that our children need some special things, and making sure that they're providing them through the school district.
We really had to rely on technology to help facilitate some of the needs of our students, and so we're always looking for new ways to help our parents and our students interact with us in the classroom. We have some great new technology that we've added. The Infusion Suite just got an amazing makeover with technology, and we've added iPad Pros into every infusion seat upstairs. There's links right there where students can go in and click request to meet with teacher, and it comes down to us here in the classroom on the first floor automatically.
Another benefit is really understanding where a child stands in school and really having that information to assess what needs to happen. Is this child attending? Can they not? Are there certain reasons? What do we need to do to help facilitate? As a clinical neuropsychologist, I work with children and their family to evaluate their thinking skills, meaning that I'm looking at their memory, attention, focus, problem solving, as well as their academics, like their reading and math. And we do one-on-one testing of the children to see how are they scoring, is there concerns in their scores, what is needed from a treatment planning standpoint to help them progress in the future. Some of the diagnoses that children here go through have problems, result in problems in someone's thinking skills. So for example, a child with a brain tumor, after the brain tumor, even after treatment and they're a survivor, you can still have long-lasting problems in your thinking skills and your ability to do certain types of tasks. And so this evaluation really helps to guide what necessary interventions and really help the school and the family to understand, how does this child perform and function now after this treatment, after this diagnosis.